You're audible, ma'am. You please continue.
So welcome everyone. Myself, Dr. Jyotsna Jain, and I welcome you all to the IToP SPSS program, induction program, which is scholarship for psychotherapy and supervised sessions for faculty and PGs. We are going to run an online and an offline program. The online program, induction program, is going to get initiated today, and offline program will shortly get initiated in Bangalore at St. John's Medical College. The online program shall be supervised by Dr. Matthew Verghese, who is former professor at NIMHANS and currently an adjunct faculty at St. John's Medical College. And the offline program shall be supervised by Dr. Raghu Ram, who is also former professor of NIMHANS. For the IToP SPSS online program, we have got 5 scholars who are faculties at different esteemed institutes who have been selected. And their name are Dr. Rajiv, Dr. Anirudh, Dr. Dhwani, Dr. Nitisha Verma, and Dr. Mithun S. So without any further delay, I would want to invite the chief guest of today's session, Dr. B.N. Gangadhar, whom everybody knows is ex-director NIMHANS and currently chairman of NMC. Sir, I welcome you on the behalf of IToP SPSS team to kindly deliver your words, motivational words to our IToP SPSS scholars, sir.
Dr. BNG is mute. I think he has to unmute himself.
Sir, I would request you to unmute yourself, sir.
Not many people are seen on the screen.
I think it's logged off, ma'am. We can either wait or go on to the next speaker.
Yeah, I have just messaged him. Meanwhile, I will request all the participants of this program to please keep their videos on. It would be good to interact, while seeing you at the same time. So, B.N. Gangadhar sir, we all are waiting to listen you, and if you can please unmute yourself, sir. I think
Jyotsna sir will come in between. You might proceed with the next in the agenda. Pratima Murthy madam also has said she will join.
Share thoughts on this forum, as well as give your message for our IToP's SPSS scholar.
Oh, Gangadhar is on.
Sir has joined. Sir, I would really request B.N. Gangadhar sir to please give your message to our scholar.
Yeah, thank you so much. I got a little disconnected with some other preoccupation. Wish you all the best. Congratulate the entire team for taking this initiative. Training in psychotherapy is a dire need. Training in structured psychotherapy is even more important. Certifying psychotherapists from the psychiatrists training is even more important. Together, all these lead to making sure that the insurance issues related to psychotherapy can be strengthened. The lack of this has made psychotherapy be available to only some who are affordable, but not to the rest. We have not been able to introduce these things into governmental insurance schemes, including, for example, the Ayushman Bharat. So we need to work towards that and make sure that the practice of psychotherapy remains as ethical as we can, and minimum guidelines have to be prescribed by this group over course of time as we are continuing to train people and gain more and more experience in this matter. So all efforts have been put in place, and I believe one more 2 batches have been approved. I was told to get trained, and one in a physical mode and one perhaps in a virtual mode, which is a extremely welcome development in the Indian Psychiatric Society and in the psychiatric profession in general. So I wish each one of you the very best, and I'm hoping with this more and more training opportunities will be created, perhaps regionally, different colleges, different institutions, and maybe including the Digital Academy of NIMHANS, and also in the Telemanas program, how we can get these things to be used for at least a higher level of psychotherapies that have to be provided. So I wish all the best, and I'm so happy and I'm delighted to be with so many stalwarts in the area of psychotherapy, although personally I may not claim any mastery on psychotherapy. Good luck and all the best.
Thank you so much, sir, for your motivating words. I would now invite Dr. Savita Malhotra, President of Indian Psychiatric Society, to please share her thoughts on this forum and message for our scholars.
Savita is not there, I think.
Okay. So we can move to the next speaker.
Devashish, is he there? Devashish? Is she there?
She doesn't seem to be there.
So, sir, we'll move to our next speaker, Dr.
Yes.
H. Basvanagodappa, who is Vice Chancellor of GSS Academy of Higher Education and Research. He's also Professor of Medicine who continues to teach undergraduate and postgraduate students, taking out time from his busy schedule. Thank you, sir, for joining, and we would really like your message for our scholars.
I don't think he has still joined. As
Okay.
and when they join, we can invite them.
Okay. So now I would request Dr. T.S. Satyanarayan Rao, Vice President of Indian Psychiatric Society, to please give his message for our scholars.
Unmute. TSS,
You're muted.
unmute.
So kindly unmute yourself.
I'm extremely happy that I'm participating in this program, and thanks for this invite. And this is one of the best occasion to meet stalwarts in this particular area. All along, if I can remember, psychotherapy deserves attention, and a lot of work has happened. In fact, IToPs, even 2 years ago, very actively it was doing certain programs related to psychotherapy. But consistently it is being attempted, and a regular structural features are being added is something very special. And thinking about both online and offline programs, that way those skills can be imparted, is something very interesting and quite encouraging. I am more than confident Indian Psychiatric Society will be really obliged such a program is happening, and UG, PG, and faculty, almost everybody is being involved, is actually the slice on the cake. I'm really very happy to be associated, and let me see, wherever possible, I would like to be part of it. And all the best for the program, and maybe it's a good learning experience for us also. Thank you very, very much.
Thank you, sir. Thank you for those kind words. I think Dr. Pratima Murthy has joined us. Dr. Pratima Murthy is Director NIMHANS, and she herself has a keen interest in conducting supervised sessions of psychotherapy. So I invite Madam to share her thoughts on this forum and give her message to our scholars.
Hi, for some reason, my video has just decided to give up the ghost. It was fine all this while. But so I just don't want to delay the proceedings by trying to come online. Nevertheless, I wanted to say it's such a delight that that this training on psychotherapy is being organized. I have been a part of psychotherapy training, both as a trainee as well as a trainer for many, many years. I had the advantage of having Dr. Shobha Srinath as my psychotherapy supervisor. And I can't tell the participants of this program, how good it is to actually have a mentorship for psychotherapy. I believe that I learned psychotherapy, I benefited from the psychotherapy training in two very important ways. One is, of course, the kind of wisdom that my psychotherapy supervisor could impart. And I believe that helped me really to understand, how psychotherapy needs to be delivered, what are the main components, what are the common kind of ingredients to have a psychotherapeutic relationship with a patient. So it was the general aspects of psychotherapy that I believe I learned very well. And the second was the learning that occurred with my co-supervisees. I think it built an amazing team of people who were willing to look at themselves, the way they conducted psychotherapy, patient-related variables, the whole processes. And I think that was immensely useful for all of us. And it also helped us to bond and understand it. And I must tell you, on a slightly, lighter note, that perhaps when I initiated psychotherapy, I remember trying to do psychotherapy for this individual who had blasphemous, he was actually a religious person, and he had blasphemous images of the Virgin Mary, with a lot of sexual obsessions. And at that time, we did not have many of the specific anti-obsessional agents. So I remember, of course, whatever psychotherapy could do to help him, at least to alleviate his distress, I did. Fortunately, anti-obsessional drugs also came in. But I believe a lot of my patients have been helped through this kind of psychotherapeutic program that we conducted. Later on, when I became psychotherapy supervisor, it was very interesting what a kind of mixture of trainees you got to actually have psychotherapy supervision for. Some of them were very excited, very keen. There were some skeptics. And if I can claim some success of the psychotherapy supervision, it was converting some of these skeptics to believe that there's some benefits that psychotherapy offers. So in our day-to-day practice, I believe that, this is a very, very important component of our training. And it's sad that, there is no formal training. So I'm delighted. In fact, I think it was a couple of years ago that Dr. Arun Kishore, who is in the UK, who's an alumnus of NIMHANS, Dr. Matthew and others started Ballant groups for training. And I've heard from people how useful it was in terms of learning, some of the psychotherapeutic methods. Of course, one can go on about specific schools of psychotherapy, whether it's cognitive behavioral, psychodynamic, mindfulness, the newer waves of psychotherapy that have come up. But I believe they are all nuances. And I'd like to say something that Dr. Shyam Sundar, one of our very senior, psychiatrists and consultant at NIMHANS, used to really advocate the eclectic approach, where you learn to pick up some of the good aspects of a variety of, psychotherapeutic approaches, try and take from them what is most practical and convenient for patients. Earlier also, we believed in what is called the YAVIS. I don't know whether that acronym is still popular in current day, that it had to be the persons who benefited most from psychotherapy were young, attractive, intelligent, verbal, and sensitive people. But I don't believe that. I don't prescribe to that anymore. I believe that everybody, irrespective of their backgrounds, can be supported in a variety of manner in terms of the psychotherapeutic techniques and approaches. The common things, which include good communication, good listening skills, good responding skills, are something that all psychiatrists must learn, even if they don't do any formal psychotherapeutic training. And even that needs to be trained as well as learned. I also wanted to end by saying that again, Dr. Shamsundar was and always used to talk about psychotherapy, not just in the way that it kind of helped in dealing with problems, but also how it helped people to kind of improve themselves, to work towards a more ideal character. And during COVID, listening to Bhagavad Gita classes, I believe that I got a lot on how you can also use more culturally adaptive ways, particularly the Gita. And my colleagues are working on the Ramayana as well. And of course, on more culturally relevant texts to actually take components of that and use it depending upon the context and the way the individual is kind of inclined to take this kind of thing. We also had a conference I think a couple of years ago on psychotherapy, and I remember the kind of demand there was for that conference, which Dr. Muralidharan organized. And therefore, I believe that 2 or 3 things need to be done. One, of course, is a sensitization training like this to try and incorporate psychotherapy training based on cases in different kinds of medical institutions, and to have a good supervisory program going forward. I think all of these will make us not just better psychiatrists, but better humanists going forward. Congratulations to everybody who's been involved. Thank you, Kishore, for asking me to speak. We just heard Dr. Gangadhar say that even though he doesn't do formal psychotherapy, how important it is. And I do hope the NMC will also recognize this as a very important part of training in the departments of psychiatry going forward. Thank you very much.
Thank you, ma'am, for those enlightening and insightful experiences of yours. I hope scholars will use a few of them in this training program. Moving forward, I would want Dr. Debashis Basu, who is Professor and Head of Department of Psychiatry in PGIMR Chandigarh, to kindly share your thoughts on this forum, sir, and your message for our scholars.
Thank you, Dr. Jyotsna, and thanks to all the organizers, the brilliant ones, the enthusiastic ones. I've known Dr. Kishore for some time now, and it's amazing that how he always, in his very congenial and humble style, with an ever smiling face, he has been at it for years now. I told him last time when he called me, I said that it's people like you who keep things, going the fire, going for a young person's heart. So yes, so congratulations to the entire team. Of course, it's always a team effort, and the IToPs and the IPS special section and everybody. I think very important points have already been made, starting from Dr. Gangadhar, of course, and then Dr. TSS Rao, and finally Dr. Pratima Murthy. Very important points made, especially the last couple of points made by Madam, saying that the cultural adaptation, not just adaptation, but probably using it in the cultural context. When jokingly, when our students are always asked during MD final at times that what's the contribution of Professor N and Vig, that's one of the standard questions which people ask in MD psychiatry in PGI. So somehow people always end up with, or rather they blurt out with Hanuman complex. They leave the community psychiatry and the other very important task later, but it props up with the idea of Hanuman complex, just to show in a lighter vein the importance, what he realized way back, 60 years ago, more than 60 years ago, of having the culturally picked up complex. Somebody spoke about examples from Ramayana or maybe Mahabharata or Bhagavad Gita and all those things. But that's besides the point. That's not all about psychotherapy. I believe the major point is that this particular initiative is so important, because although, as Madam said, there is a need, but at the same time, it tends to get drowned, if I may use the word, or submerged under the deluge of the usual kind of psychiatry. I'm not trying to put psychotherapy as a competitor to quote unquote biological psychiatry or to social. That's not the point. I think we have all come over that phase of this versus that, like nature versus nurture and stuff like that. But we all know that psychotherapy is an essential, absolutely essential component of all therapies, of all psychiatric therapies. Even when you are talking about a hardcore biological therapy for a patient with bipolar disorder who is on lithium prophylaxis, even there is a vital role of psychotherapy in some form, eclectic form, or a particular only psychoeducation, or a supportive form, or in a elements of cognitive behavioral form, etc., etc. So it's an essential thing. This message at times, unfortunately, maybe we are the teachers who are partly responsible for that, we tend to kind of dilute it. We tend to submerge it under the deluge of the other kind of therapies. I guess that this particular initiative, both online and offline, will be very important to bring up this message of the importance and the feasibility of psychotherapy teaching online, uh, as well as offline, of course. In PGI, of course, we have had this. We have been very lucky to have, as Madam was saying about, very lucky to have wonderful teachers, Dr. Shama Sundara. I've never had him as a teacher, of course, and other people. But we have had Professor Vijay K. Verma, a doyen of psychoanalytic therapy, and others, and Dr. Salman Akhtar, who is one of our alumni and who have given that online course, a 10-part course, Primer of Psychoanalysis, which is hosted on the PGI psychiatry website and hugely popular. Kishore was telling me the other day that so we have some resources, and this is time to pull up our resources. We have wonderful resources among us to share, to distribute. Knowledge cannot be, and the best part of it that is, I'm told that it's free. I can't believe it actually. I think later on one should start charging some money perhaps, but as long as we can keep it free based on your selection criteria, I think it's a wonderful initiative. I wish all the best from the core of my heart. Thank you very much and congratulations. Thank you.
Thank you so much, sir. I would now call upon Dr. Pratap Sharan sir, who is Professor and Head of Department of Psychiatry, AIIMS, Delhi, and he also runs a student wellness center, and he has also a key role in running few psychotherapy forums by himself. So, sir, we would want to know your thoughts on this forum and message for our scholars.
Thank you, Jyotsna. I would like to thank Dr. Kishore also for inviting me here. Like all of us know that psychological understanding and skills are core elements of psychiatric training. So it's a little kind of odd that psychotherapy training is given to so few psychiatrists in India. And in that sense, I would kind of agree with Professor Basu and Professor Pratima Murthy that NMC should probably focus a bit more on psychotherapy so that it becomes a core component of our training modules per se. Learning psychotherapy is important because it helps us to understand patients, their intimate relationships, their family, cultural and developmental issues. It makes a psychiatric work itself much more rich, interesting, and manageable. So it's not only about doing psychotherapy, just knowing psychotherapy is very good for general psychiatric practice as such. It helps us to reflect on ourselves. We also, as Professor Pratima Murthy mentioned, that we learn to be a part of supervision, to be a part of peer group. And the joy of being in that kind of supervision and peer group is an important aspect of learning psychotherapy. Psychotherapy also helps us to be a little bit more humble and recognize the role that other mental health professionals play. Like we learn to value psychologists much more when we ourselves try to do psychotherapy and see its nuances as well as complexity. Personally, I have not been trained in psychotherapy, but after I took on the student wellness, I've had to do a lot of psychotherapy. So I had some exposure in PGI, and both as a senior resident when I was a trainee, as well as when I was a faculty there, and often on a little bit of training was there available at AIIMS from Professor Manju Mehta and Professor Shakuntala Dubey when if one was interested, and I was interested, so I would kind of ask them. One thing which I want to tell the trainees is that I do about, particularly for student wellness, I do about 12 to 18 hours of psychotherapy per week. So it's possible to do psychotherapy. It's not only that you are using those kind of skills in your regular work, you can actually do psychotherapy in proper sessions. And my skill set is not great, but what I find is that even if one did something like supportive psychotherapy or client-centered psychotherapy, these things are very useful for uh, largely from the students that I deal with. So the practicing psychotherapy makes a lot of sense to me. I have actually, after that work, I started training in psychoanalysis now for 1 year. And when I retire, I think I don't want to be a psychiatrist. I want to be a psychotherapist. So thank you. And I would like to kind of thank the organizers for letting me speak here. And I'm particularly looking forward to the trainees to enter this training with a lot of enthusiasm. Thank you.
Thank you. Thank you so much, sir, for your perspectives on psychotherapy. And now I would move forward and invite Dr. Amrit Patujoshi, who is Honorable General Secretary of IPS. Sir, please give your message to our scholars.
Thank you so much. And first of all, let me congratulate the forum for consistently bringing, excellence for the teachers, and that's huge. I have always seen Dr. Kishore has been always active, always in the forefront, and I think the whole team is a wonderful team, and we are proud to have such people in our organization where they're actually doing a lot of work without much ado. And the whole psychotherapy is something, my colleague Dr. Aleem is there. As you know, we have a webinar which is primarily focusing on psychotherapy, the Thursday musings, and we have the who's who of psychiatry and psychotherapy who are in our platform. And I think this is a very, very essential skill that every psychiatrist must have, whether they perform formal psychotherapy or they don't do formal psychotherapy. But the skill sets are very important. There's a very important arsenal in every clinician's domain. And I think people will get richer and wiser and will be able to deal with their clients much more. So I would like to congratulate each and every person who is part of this program, every teacher who is going to take part in this program. And from the IPS, we promise you 100% support and more if you need anything. And thank you again. Congratulations and all the best.
Thank you so much, sir. I would invite Dr. Aleem Siddiqui, Honorable Treasurer of IPS, to kindly give your message for the scholars and to the forum.
Thank you so much, ma'am. Thank you so much. My respect and regard to all of you. Your team has been doing a wonderful job time after time. This is also personal because my junior Dhani is also there. So she'll be one of your students this time. My all the best to all the candidates. I have two requests. So if you are working in psychotherapy, if you can work to make psychotherapy shorter, more in sort of more capsule, because some people will definitely need a proper extended version. If you can think of keep this being a bit miser about the time. So I think because manpower is less, in less number of less amount of time, if you can see more patient, that is good. It saves patient time. So what sometimes I observe, sometimes therapies are lingering on more than it is required. So a bit shorter version of therapy is my suggestion. And definitely as AI is coming in, so we as an IPS have to make some platform, because I see people who are working in many other fields, who are working as storytellers, who are working as healers, and the IT persons, they are making the apps, and they are this space we are not yet we have covered. So these are my two suggestions to your team. Thank you so much once again. My regards to all of you, and back to you, sir. Thank you.
Thank you, sir, for your recommendations. I would now call upon Dr. Mohan Isaac, sir, for his message to the team and forum and scholars, sir.
Thank you. Thank you, Jyotsna. I am also delighted to be participating in this induction program. I have been personally associated with the IToP and the SPSS. I was also, in a way, along with them, interviewing all the scholars from that larger group, the people who have been selected, who are going to attend the program. So I know the background of these people. But in the short time that is given to me, I would like to acknowledge and compliment the contributions of various people, many of whom who are in the audience now. The first is Dr. Ajay Kumar, who did a survey about the need of psychotherapy in India. Many of you may have participated, large number of people participated. It is published in the Indian Journal of Psychiatry. This is, documenting something which we knew. There's no formal psychotherapy training in any other places, including some of our best known training programs. A lot of people have finished their MD, some of them have finished their DM, but they have not had any formal psychotherapy training program. That was an impetus for the ITops and all to, initiate this kind of program. Then I would like to acknowledge and compliment the role played by Matthew Verghese, who volunteered to conduct this program. Of course, Matthew was introduced. It doesn't need any introduction. Pratima mentioned that he was one of those persons not only who underwent psychotherapy himself, but was in charge of the supervisors program in NIMHANS for many, many years. He is retired from NIMHANS, but he is the key person who would be doing the online program. He has primarily taken charge and he has volunteered his time for the next 6 months to conduct the program. Of course, in passing, it was mentioned that there will be also an offline face-to-face program which will be held in Bangalore. It will, of course, be available only for people who are in and around that place, and that would be led by Dr. Raghuram, again, somebody who was leading psychotherapy supervisor as well as group leader, etc. in NIMHANS. Then, of course, I would like to acknowledge and compliment the role played by the Indian Psychiatric Society because their active support is absolutely needed. Their PG committee and the UG committee. They have, there are so many committees in IPS, not many ordinary members of the IPS know what exactly these committees are doing, except maybe some of the committees who have some programs. During the annual conference, of course, something is released, etc., in the inauguration. But the undergraduate and postgraduate committee have been working together in the last two or 3 years very actively in improving the quality of psychiatry teaching across the country, and also now they are focusing, they are supporting the ITops and others interested in promoting this program to facilitate this program. So the president, of course, may join. The vice president already spoke to us. The secretary and treasurer spoke to us already. They have given very valid recommendation. Alim, of course, talked about the need of time. I'm sure the supervisors and various other stalwarts here are aware of many of the things, and we need to develop that kind of it. Then I want to also acknowledge the key role played by IToP. I'm talking about Kishore, Kiran. Kiran was already introduced as by TSS as a gold medalist, who continues to be a gold medalist all through. He's a professor in one of the medical colleges. Kishore, Vinay, and Kiran are the key people, pillars of the IToP, who's been doing continuously. I mean, they have done scholarship programs, they have done various things to improve the quality of teaching in the large number of postgraduate training centers where many people are designated postgraduate teachers without any experience. So this is the latest of the programs of IToP, and that is the supervisor psychotherapy supervisors training program. The fact that people who are heads of the departments of psychiatry in PGI, in AIMS, and I was told that Jagdisha, who is the head of the department of psychiatry in NIMHANS, also was to attend this program, but because of other commitments, he is actually going to be physically present in the induction program of the offline the course in St. John's Medical College, where Raghuram will be starting the program. Otherwise, Jagdisha would have been here, but Jagdisha's absence has been in a way filled by two of his very illustrious predecessors as heads of the departments of psychiatry. I'm referring to Dr. P.N. Gangadhar and Pratima Murthy. Of course, to mention them as heads of departments of psychiatry would be demeaning because they are holding much higher position. Pratima is director of NIMHANS and Dr. Gangadhar is the chair of the National Medical Commission. So now attending the interview for the IToP to pick up the scholars was a kind of an eye-opener for me. I knew this already. In fact, some of the people who are sitting here, I know Anirudh, Basu, and many of them are already very senior faculty in many of the All India Institutes of Medical Sciences in Kalyani, in various places. But they said that they are keen because when I was sitting in the interview board, I was wondering why are these senior people who are MD from PGI, DM from All India Institute of Medical Sciences, why are they applying for this kind of a online psychotherapy program? And they said, we want to be supervisors, we want to initiate this kind of program in our own departments, etc. So on the whole, this is an excellent program. I'm delighted to be part of this. And I think the 35 plus people who are all heavyweights in the field of psychiatry in India in training, like Dr. Pratap Charan, Dr. Basu, and others, and the presence of the chair of the National Medical Commission and the director of the NIMHANS, etc., shows that this is an important program. I'm happy, and I would like to pay a compliment to Jyotsna, who is the master of ceremonies, who is doing it so ably. She herself introduced herself as one of the scholars of the IToP's first program. So it is a delight to see so many people participating in this program. Wish you all the best. Matthew, of course, is going to hold all the responsibility, but having known him for nearly 40 years, from the time he stepped into the man's, I know he has very able shoulders and he will be able to do not only this batch, but he will be able to contribute many, many more things for this kind of program. Back to you, Jyotsna. Thank you very much for asking me to come.
Thank you so much, sir. I would now invite Dr. Kiran Kumar on behalf of IToPS to please convey the message to the forum as well as to our scholars.
Good evening, one and all. It's a wonderful opportunity to share this platform among all the stalwarts. We all know that the number of medical colleges offering MBBS and later on post-graduation is increasing day by day. By estimation, we have about 3,000 psychiatrist faculty around, and it's expected to go up to 6,000 in the near future. So it was always an unfelt need that a faculty development program that is tailor-made to psychiatry does not exist. That's how IToP came into existence way back in 2016. And I think Dr. Mohan Isaac has already said that we have been doing a number of programs in the past. And this area of psychotherapy was always felt as an unmet need among even very senior faculty among us, including me. So that's where the idea came. And thanks to Dr. Kishore for floating this, and it's become a reality. I would like to congratulate all the current scholars for being a part of this wonderful initiative. Today, I'm also representing the subcommittee of UG subcommittee of IPS because Dr. Priyaranjan Avinash, who is the chairman, is not available today. Just a passing statement on that, what I've realized as a teacher is catching MBBS student young is the way forward. And as psychiatry has been in the mainstream by doing this, where we catch them young, I think psychotherapy also has to be a competence, particularly at least for classical disorders like depression or anxiety or bipolar disorders. Having a skill-based, competency-based psychotherapy module in MBBS would be a great start, and that is what I would recommend as a co-chairperson of IPS subcommittee. probably that will be for a later discussion. Thank you very much for this opportunity and best wishes for the future of the program. Thank you.
Thank you, Kiran sir. I would now invite Dr. Kishore sir, who is one of the key person and visionary for initiating this forum. And he also represents the IPS PG Education Subcommittee. Sir, we would all want to listen your message for our scholars and the teams.
Good evening, everyone. With due respect to the dignitaries who have come, Dr. B.N. Gangadhar, the chairman of the National Medical Commission, Dr. Pratima Murthy, the director of NIMHANS, Dr. Debashish Basu, the head of the department at the PGI Chandigarh, Dr. Pratap Sharan.
Cannot hear you. Could you be louder?
Is it audible?
Louder.
Yes, sir, it is audible, but sir, little more.
Yeah. So at the Indian Psychiatry Society PG Education Subcommittee, we were curious to know why the postgraduates are so much interested in psychotherapy. And some of our surveys, which involved more than 600 participants, gave us an idea that there is a lot of need for psychotherapy training. And from our guidance we received from Dr. B.N. Gangadhar, Pratima Murthy Madam, we were very lucky to have been guided by Mohan Isaac sir. And then we found Matthew Varghese sir to help us design this program. And Dr. Raghuram sir, who pitched in to provide the offline extension of this initiative. So we knew that we have very good mentors, and we knew that the faculty across India are keen to take up this training, and it will hugely benefit the patient care services. This is a very small step, and psychotherapy is always delivered to a very small group over a period of time. So it is a very intensive, but in a period of 6 months, you might have some glimpse. But we believe that, as Pratap Sharan sir was saying, that it should get percolated to the undergraduate and postgraduate studies at all levels, and these people should be the torchbearers for the next group. And as Mohan Isaac sir has said, that everybody is at same level when it comes to learning. So we were also very happy to know some of the best institution across India who wanted to apply for this scholarship program received it, and it's a learning process for us also, and we will see how this goes over a period of time. So from the IPS PG Education Subcommittee, we are delighted to be part of this program, and we wish them all the success. Thank you, Jyotsna. Over to you.
Thank you, sir. I think I would now invite our supervisor for this forum, Dr. Matthew Varghese, to kindly address the group and give your message to the scholars.
Thank you very much, Jyotsna. And as Mohan said, it's really nice to see you taking active part in the IToP, considering your recent being a recent pass out from NIMHANS and being a young faculty. Thank you very much. First of all, I want to thank the IToP because I've been following the IToP for a few years now. Dr. Kishore and his band of active coordinators of the IToP, I think one of the best things that has happened to psychiatric education in the country is IToP, and the way the programs that IToP has been doing the last few years. So I really commend Dr. Kishore and all the other people who are working with him very actively, very enthusiastically in seeing that psychiatric education is sort of uplifted as far as the country is concerned. Secondly, I'd like to acknowledge the collaboration of the Indian Psychiatric Society. All of us know that psychiatric societies all over the world, whether it is the Royal College, the American College, or Australian and Canadian colleges, they've all been so intrinsically involved in psychiatric education for many years. And I think one of the things that the Indian Psychiatric Society has not been fully immersed in is psychiatric education. And I'm very, very, very happy to see this collaboration between IToP and Indian Psychiatric Society in bringing about quality psychiatric education in the country. And I think them working towards good psychiatric education, together with the National Medical Council, we're fortunate to have Dr. Gangadhar at its helm. But I think in the last few years, we've seen a very major change in the way psychiatric education is sort of shaping up in the country. And I think it's a great thing that all these people are working towards that. And I'm always happy to give whatever inputs are required for this effort. And that's a commitment that I will make and I've always made. All of us, I'm sure, do psychotherapy in some way or the other. Even the so-called prescribing psychiatrists who believe only in psychopharmacology, they cannot write a prescription and hope to not talk to anybody. They have to talk to them, talk to the patients and clients and families, and tell them how, why, and in what way medicines are going to help them. So all of us do psychotherapy, and when a patient goes to a doctor, he expects the psychiatrist or expects even a general doctor, physician, to talk. And more so when they're going to a psychiatrist, they don't want to be just drugged by the psychiatric doctor. They want a conversation. So they look forward to a conversation with the doctor, with the psychiatrist. And I think it's this human-human connect that is so valuable and it's so useful in the process of healing. And I think if psychiatrists don't learn or don't know psychotherapy or claim they're not doing psychotherapy, and I think it's a misnomer. All of us are doing psychotherapy, but I think all of us are afraid to put a label to it. All of us are afraid to say that we are doing this or that kind of psychotherapy. If I were to look at all the work that has been done across the country, especially in India, or even other parts of the world, you will see that the majority of people do what is called a supportive psychotherapy. Even if people are doing CBT or DBT or RET or whatever it is, finally, it's very few therapists who are absolutely true to a manualized form of therapy. And even when they are, even if it's manualized, many times it's very difficult to purely stick to a manual because as human beings, each human being is very different. So my aim in running this program and also to imparting this particular program to this group of trainees, who are all faculty this time, is essentially to highlight and enlighten them about supportive therapy and to that extent, supportive and say to some extent, dynamic therapy. And as somebody mentioned, I think it's Alim who mentioned that it should be brief as far as possible. We have told the trainees that I will mainly be focusing on supportive and dynamic and briefer kind of therapies. So the trainees all know that. And I would like to say that when Mohan and some of the members of the IToP and myself interviewed many of these people who have applied, I think more than 12 people had applied. But we have decided this time to give this forum to the psychiatry faculty who have opted to join this program. And we will have a separate program for the psychiatry senior residents. All of you know that we are already running a program which goes on twice a month for psychiatry residents. That is already going on for the last 2 months. So that is being run on the second and fourth Tuesdays of every month. So that is already going on. So this is the forum for psychiatric faculty, seniors, and also we will find a forum for the psychiatry senior residents who are all going to be supervising and training people in psychotherapy. So I just want to say that I'm immensely happy to do this and I'm happy to be running this program. And I hope that I am, like Mohan said, a lot of it rests on my head, my shoulders. So I hope that it's rather sort of scary in some sense that, everything rests on me, and I'll really have to sort of, be vigilant and on the ball to see that all the trainees get whatever they signed up to do. Thank you very much.
Thank you, sir. And this almost brings us towards the end of the program, but we also would want to, listen from our scholars. And therefore, we will start the rounds of introduction for our scholars. I would like to invite Dr. Anirudh Basu to kindly introduce yourself.
Good evening, esteemed faculty members, teachers, and senior faculty, all faculty members. So it was a privilege for me to be in this forum, and hope that, as said, that the urge mainly came to participate in this session because I was about to design psychotherapy training modules for my residents. So hope I will get more insights and more guidance in this, and overall that will enhance the teaching, training, and interest of psychotherapy in all residents and psychiatrists together. Thank you all. Thank you everybody for giving me this opportunity.
Thank you, Dr. Anirudh. I would now call upon Dr. Raji to kindly introduce yourself, and also you can check with seniors, what all you are aiming at to get from this forum.
Good evening, everyone. I am Dr. Rajiv Ranjan. I am working as Associate Professor of Psychiatry at All India Institute of Medical Sciences, Patna. Before joining this place, I was MD from All India Institute of Medical Sciences, Delhi. Then I did my senior residency from the same institute. And briefly, I worked in AIIMS Bhubaneswar and Bhopal also before joining to this institute. So this was a brief introduction. Why I've joined, I would like to join this course because I was a little bit deficit in our training period. That was most major motivation to join this type of particular program. I was searching for it. I was not much intended to do with international faculty because I was more inclined towards to our faculty who was more interested in teaching us with related to our cultural content that already narrated by our senior faculty members also. This is the, I think so. I believe that this is the right time to join this type of course so that I will be more helpful to our resident in our teaching program. I can improve my clinical skill also. And also it will also help me in research activity. We have planning for psychotherapeutic intervention. And thank you for the opportunity given to me for this type of courses. I am very humbly, gratitudely telling that I am very much interested, and I will like to give the 100% for this type of course. I had already shown inclination also in the previous interview also. Thank you very much.
Thank you, Dr. Raji. I would call upon Dr. Dhwani to kindly introduce herself.
Hello, good evening, everyone. Myself, Dr. Dhwani Satija. I am currently working as an assistant professor in ERA Lucknow Medical College, and I'm really humbled by for giving me this opportunity. I'm looking forward to upskilling myself and sensitize myself and my residents in psychotherapy, which is much needed in this field. Thank you.
Thank you, Dr. Dhwani. I would call upon Dr. Nitisha to kindly introduce yourself.
Good evening, all. I am Dr. Nitisha. I am currently working as assistant professor at Dr. RML Hospital, New Delhi. And why I joined this program was to improve my skills as a clinician and also as a teacher. So I'm really looking forward to this program, and thank you.
Call upon Dr. Mithun to kindly introduce him.
Yeah, greetings everyone. Hope I'm audible. Firstly, I would like to thank for the IToP SPSS and IPS team for choosing me and selecting me for this workshop and this sessions. I'm currently working as associate professor in Srinivas Medical College, Mangalore. So I'm looking forward to this program to fine-tune my psychotherapy to the patients and also my students as well, and also to relive my post-graduation days, which were some of the best days of my life. So I'm looking forward for this program. Thank you.
Thank you, Dr. Mithun. And this brings us to the end of the program. Dr. Kishore, if is it okay, can we end the program or?
I'm Dr. Veena Kapoor. Can I take
Yeah,
2-3 minutes?
yeah, madam. Yeah, madam.
Okay,
Please go
okay.
ahead. Yeah.
So I did my psychiatry in the US in Cincinnati, which was a psychoanalytic school, there. And so my program was very much psychotherapy oriented. In fact, it was Freudian analytic school. So although Freud is now kind of way past, yet I feel that his basic thinking, the basic premises is still operating. And I feel that in psychotherapy, the relationship between the therapist and the patient, the client, is most important. And in that, I think Freudian theory does play a part because there's the issue of transference and all that. Now, Dr. Matthews, Verghese Matthew, did talk about some things. Most of the people are doing supportive therapy of some kind or the other. But psychotherapy itself, I think, is one way, a unique way, where not every patient gets involved with the therapist. It's the personality of the therapist which matters. I think although it was not necessary, it was not mandatory, we were all encouraged to have self-therapy. And I think that was the best learning experience. When you, as a therapist, are sitting in the patient's chair, in those shoes, you realize, how you deal with your feelings. And that is dealt with in supervision. So it becomes a triangle, the patient, the supervisor, and you. And that's the most learning process. Now, my thing is very experiential. I came to India in the early 90s, and while there psychiatry was very autonomous, here it's more family oriented. So that was the first change that I noticed. It was very difficult, to relate to one individual patient. Anyway, that changed. So there's family therapy, there's couple therapy, there's sexual therapy. There are all kinds of more supportive therapies that are done here. And I think, yeah, they are done, although that doesn't take too much time. Uh, Real psychotherapy would need time, and the therapist has to have that personality and have that uh, in their mind, if they want to do therapy. They just have to get time out, even though it may be just 2 sessions a week or 3 sessions a week. One cannot do psychotherapy in 15 or 20 minutes. The other thing that I want to say is I haven't done too much teaching here. I was in a general hospital, Batra Hospital here in Delhi. And most residents, most other doctors, as we know, do not really actually understand what a psychiatrist does and what kind of patients we see. I mean, we are seeing with the Pagal population, I think. But I did talk to about 15 to 20 residents there. And after talking to them, they really became interested. It wasn't just that one had to prescribe medications. This talking and communication is so important, they realized. So out of these 20, at least 4 or 5, especially those who are doing medicine, were truly interested in psychotherapy, whether it's for themselves or a family relatives or whoever. In the same way, I had a clinic cum nursing home in Delhi. So there we had 2 other junior psychiatrists, 2 psychologists, 1 alcoholic counselor, and 1 kind of a physical thing like, yoga, exercise. So we as a group every second or third day would sit as a group therapy. And it was bringing up a patient and discussing, but basically it was more psychotherapy because others were not able to prescribe medicines. Now, so I would say most of us here are biological in their thinking. And I'm so glad that this thing is started because I would feel very uneasy when I was with a group of psychiatrists here because psychotherapy per se was never done or talked about or whatever. And I remember some patients would say, "Usne bataya hai ki aap baat karte hain." And every patient who comes, first of all, he says, "Mujhe goliyan nahi chahiye. Main chahta hu ki koi mere se baat kare." And most of our patients do not have healthy relationships with their parents or friends or whoever. So I think it's very, very important. Psychotherapy, I think it's different from supportive therapy. And I'm glad that now it's coming up, and you all are getting into it. Now, as I said, I've retired, but this is a deficiency that I felt in our system of training here in Delhi. Or say in the IPS all of India. So this is what I had to say.
Thank you, madam. Thank you for your insights. And I would really take this opportunity to thank each and every member present in this meeting. The teachers, psychotherapy supervisors, the IPS team, IToPs, and scholars to come on this platform and learn from the motivational words which our teachers had to share, and hope we all learn and teach together and serve the purpose step by step. Thank you so much. We can end the meeting now.
Thank you.
Just the
Thank you.
scholars and the supervisors can stay. Rest people can leave. Yeah, so that
Sure,
we discuss
sure.
that. Yeah. Thank you. Thank
Sure.
you, everyone.
Thank you, everyone.
Maybe Jyotsna and do one of you want to stay, Kishore or Kiran or something?
Sir, I'll stay.
Okay.
I think Jyotsna will be
Jyotsna, would
here
you like
and
to
all
stay?
the scholars will be here. Rest can leave.
Thank you very much, everybody. Good to see all of you.
Good evening, sir.
Sir, now it is your space.
Right. Okay. So I think what Kishore and the IToP intended is that this next few minutes, say maybe 15, 20 minutes or even less than that, is to basically talk about how we're going to do this, decide on a day, time, and so on. That's what I wanted to get from all of you. So, I mean, one of the days, I think the IToP has kind of chosen Tuesday. I don't know whether Tuesday is convenient for all of you. I run the residence training program in psychotherapy on the 2nd and the 4th. So I can do this on, and we are supposed to do 12 sessions in 6 months. So I would think 2 sessions every month. Some sessions, if I'm not there or something happens, then we might push it forward. But I hope that in these 12 sort of brief sessions, I will get to covering quite a bit of what all of you want to learn in psychotherapy. So I'm just wondering whether we stick to Tuesday, or do any of you have any preferences? And or is 6 o'clock to 7 o'clock okay? Because again, I'm hoping to start at 6 and end at 7, so that we don't sort of spill over. We don't tax anybody into their own family time and free time. So I'd like to keep it as tight as possible in that sense. So if you think Tuesday evening is not okay, Please, let's discuss it now. Is there one more person who's supposed to?
Can I speak?
Yeah, sure. Anybody can speak. Rajiv is not there. No, Rajiv is...
Raji, yes.
You want to call him back, Jyotsna?
Yes, sir. I will be giving
He
him
may
a
not
call.
have. He may not have known that
Yeah.
we are going to continue talking.
Yeah, yes. I'll give him a call.
Yeah, yes. Go ahead. Who's that? Nisha, is it?
Nitisha. Nitisha will act as the rapporteur.
Nitisha, you were saying something.
Yes. Sir, I was. Yes, sir. Sir, I was thinking that would it be better to have it on a Saturday evening, maybe, because Tuesdays I don't know if people will be back by 6 at home, so from their work.
Saturday at what time? Nitisha, you're frozen. You want to put off your video, Nitisha, because I think your bandwidth is probably not good. Nitisha, you're frozen, so we didn't hear you. Yeah, what
Sir,
time?
I was saying that Tuesday, like any working day, if 6 to 7, if everyone will be back by 6 at their home. So I was just wondering, so whether a weekday or Saturday evening would be better for all. So I wanted to discuss that.
Sure. What time on Saturday?
It's the same time, sir. Matlab 6 o'clock, 5 o'clock, yeah, 5 or 6 anytime. Because I was just thinking, so if if somebody gets stuck in traffic and also, then it might be difficult. So there may be one thing, sir. That's all.
I know, I understand. My own experience is that Saturday evening, everybody is kind of winding out for the weekend and time for their family. And Saturday evening, so people who have practiced, that's a more busy time. Saturday is the most busy time for people who are having practice. I don't know how many of you have private practice, but that's either practice time or family time. But if all of you are